Hi, my name is Becky. I'm a nurse practitioner at Ozark Regional Vein and Artery Center. Today we're talking about vein treatments and blood flow. Circulation is when the blood leaves the heart and the arteries take the blood down to your toes. And then it's the job of the veins to get the blood from your toes back up to your heart. And in order to do this, your veins have to sort of defy gravity, right? Because gravity wants to push everything to the floor. And so your veins have valves, and the valves open with the heartbeat, and then they close in between heartbeats to prevent gravity from pushing the blood down. And so if these valves become incompetent, they allow gravity to push the blood in the veins down, and that backwards flow of blood is called venous reflux disease. And this is blood that should go back up to the heart to get reoxygenated, right? But instead it's moving backwards in the vein and it's pushing in your tissues. And this is old, stagnant, it's oxygen depleted blood. Well, what does your tissue need to feel healthy and happy? It needs oxygen. And so what we do is we shut down the bad veins. Also, by stopping that backwards flow, relieves some pressure on the good veins because now they don't have as much blood to move through the tissues. And so that's why you feel better, because your tissue's getting the oxygen that it needs. So then another question is, of course, how do we shut down those bad veins? Well, there's a couple different methods. One method would be to shut the vein down. Another method would be to remove the vein. So there's a couple different ways to shut the vein down. The most commonly known one would be through thermal ablation. And thermal ablation is where we numb around the vein and we thread a catheter up that vein, and as we slowly withdraw the catheter, we're heating the vein shut or cauterizing it shut. It's a fairly simple procedure. It takes a half hour, 45 minutes, minimal amounts of discomfort on the patient's end. That's one method. Another method to close a vein down would be with an injection, where you inject a medication directly into the vein. It irritates the lining of the vein and makes it spasm down and scar shut. That would be with a sclerosant, a sclerotherapy, Varithena. The last method we use for treatment of venous insufficiency or venous reflux disease would be to remove the veins. Now, oftentimes when we talk about vein removal, people think about what their parents or their grandparents had done, which was a traditional vein stripping. Rather an outdated treatment. No one's doing that in more modern times. What we do now is something much simpler and safer and less uncomfortable, which is called ambulatory microflebectomy. And with an ambulatory microflebectomy, we are removing those large, bulging, throbbing, aching veins. They're sort of discolored and almost look like a rope underneath your skin. And the incisions that we're making with an ambulatory microflebectomy are really minute, 3 to 4 millimeter incisions. So we can remove the veins through those small incisions with relatively minimal discomfort. Of course, you'll feel the numbing injections going in, but after that, people tolerate it really beautifully. And the good thing with an ambulatory microflebectomy, other than the fact that, of course, it's very safe with minimal side effects, is that it heals beautifully. We've removed that vein where all of that blood was moving backwards and pushing deoxygenated blood into the tissue. We've removed that vein, so the incision sites heal beautifully, and oftentimes people have almost no scarring, and in some cases no scarring whatsoever. So where there used to be a large bulging vein, there's now nothing at all, just healthy tissue. So if you're wondering if you could be suffering from vein disease, go to our website and fill out our free vein screening quiz.